you've been diagnosed with a disc bulge or herniation that you will not be in a lifetime of pain. There's a lot of new treatments that have been researched and backed by a ton of evidence. So let's get into it. You got 3 ways basically to treat a disc herniation or a bulge. Number 1, the most conservative way is chiropractic. And we do that in 3 different techniques: Cox flexion distraction technique, spinal decompression, and cold laser therapy to speed up the process. We usually get about 50% pain reduction minimum in 4 weeks. Now, the second approach is a little more invasive, which would be pain management. Over-the-counter medication first, then prescription meds, opioids, and then injections, epidurals or steroid injections. Those pain management procedures only deal with the symptoms. And then the third approach is surgery, and only a small percentage of people require surgery. And that's always the last resort. So let's get into a disc and how it works. It's a soft jelly-like cushion with an outer fibrous, tougher layer that acts as a cushion in between all 24 vertebrae in your spine. Now, a disc bulge is when that inner disc material pushes out against the wall and puts pressure on it. And that bulge can put pressure on the nerve, or it can put pressure on the spinal canal itself. You can also have a herniation, which is more of a permanent injury and a little bit more serious than a disc bulge, in the sense that that inner disc material has pushed out and broken through the outer layer of the disc. In this situation, you can see a disc bulge has closed up and put pressure on the lateral recess, or the space where the nerve exits from the spine. If it were to be spinal canal stenosis, you would see the disc bulge pushing in and closing up this hole right here where the spinal canal goes through. If you have any questions at all about disc herniations or bulges, or how they should be treated, or how your particular case should be treated, feel free to comment below.